Hi, Dr. Miller. How are you today?
I'm doing great. Thanks for having me.
Yeah, we are going to get right to the questions, and we're going to talk a little bit about childhood tooth decay. So, do you believe that there is a gap between parental knowledge about kids' dental issues and action?
That's a really good question, and I can speak from experience as a pediatric dentist. As over many years, I've had the opportunity to care for many families, and the one thing that I see a gap is in understanding any effects on dental disease on the baby teeth. Could it have any effect on the permanent teeth? And also, could it have any effect on the rest of our health? And that's where that gap is, and that's where I think it's important that families and parents know that a cavity on the baby tooth, if left untreated, has a dramatically higher chance of, if it becomes infected in an abscess, to affect the developing permanent tooth. And now, once the permanent tooth is affected, that's now a lifelong potential problem for that individual throughout the remainder of their life. The other thing that we're really becoming more and more aware of is understanding the link with our oral health and our general health. As you can imagine, if we had an infection in our arm, it's probably going to have an impact on the rest of our body. Well, the mouth is no different. Any dental cavities are an infection process. Any dental infection or abscess can have an effect on the rest of our oral health. We know that there's an increase problems with diabetes and poor oral health, increase premature birth, and increase cardiovascular disease in individuals with poor oral health. So we understand that link, and that's the gap we're looking to close.
So, it sounds like it's extremely important. So, what are some of the primary culprits in childhood tooth decay and oral health issues?
Yeah, and I'm going to really focus on two areas that we think parents need to know about most. And one of those is in the very young child, that infant or very young child, in a situation where the child is put to bed at night with a nursing bottle. And in that bottle, there's formula, juice, milk, soda, and they sleep throughout the night with the bottle. That sets up a situation where the child nurses on and off on that bottle through the night. So for many hours, the cavity-causing bacteria in our mouth have access to the sugars in our mouth, and that really increases the risk of cavities. So we really encourage parents to, prior to going to bed, to feed their child. Don't put them to bed at night with a bottle if it has anything other than water. So that's an area that is unfortunately a problem that can be very problematic, that is really preventable. The other area is in that older child, teenage range, with consumption of carbonated beverages, sports drinks, and now sour candies. We really now have a double whammy effect where we have the sugar contributing to the cavity-causing process, plus the acid weakening the tooth structure, allowing that cavity process to be even more dramatic. So those are the two areas that diet play a role.
So, it's dangerous for both infants and teenagers and older children. So, what are the dangers of tooth decay in younger children?
You know, in younger children, the dangers are the effect it can have on the permanent teeth, and as we mentioned, the effect on oral health as well. I think a few things in the preventive mode, because that's really what we want to do, is prevent those problems from the outset, and that is to see a child by age 1, and we call that an age 1 dental visit. I'm president of the American Academy of Pediatric Dentistry. Our organization, as well as other pediatric healthcare organizations, all recommend age 1 dental visit, because it's not common that we see problems at that age in the child. That gives us the best opportunity to prevent problems. It also is a prime opportunity to educate the parents on things they can institute in that partnership with the dentist and the parent to really help ensure the best oral health for that child. So, those are the areas that we really think that preventive mode is most important. And the one other spot I'd like to, that's all age group, whether it's adults like ourselves or our kids, is when we think of things that contribute most to the cavity-causing process, it's more about how frequent we consume those sugary contributing beverages or foods. So the more frequently we consume them, the higher risk it is. So it's not necessarily how much, but how often.
Well, thank you, Dr. Miller, for all of these tips so far. So, as a parent, where can we learn more about good oral health for children?
The best place to go is the AAPD's website, mychildrensteeth.org. That's really the go-to internet site that has all the information for parents. That's really tailored for parents. That site was designed for parents. As well, it has a very active children area that is very engaging, and it's an educational opportunity for your child as well.
Well, thanks, Dr. Miller, again for speaking with me. I really appreciate you giving all these tips today, and thanks so much.
Thank you so much for having me.